Hi, this is Dr. Alfred Mansour, and I'm here with your Game Ready series talking about athletic hip injuries. I have no financial disclosures. A couple of objectives of this as we get back post-COVID into training sessions. I wanted to talk about common causes of hip pain in the young athletes and some strategies for hip injury prevention, and understand when further evaluation of the hip pain is necessary. Now remember, this does not replace sound medical advice and on the field coverage. So these are just tips for patients, parents, providers, and coaches on what to look for when getting back regarding the hip. I'll start with a couple of cases. Case number one, this is a 14-year-old male who returned to soccer practice after about 2 months of self-directed drills but no sprinting. It began with dull left hip pain while playing and then increased as his training increased. And then he developed acute pain in the hip while kicking the ball and when taking a free kick on goal. He began limping. He had pain when he flexed his hip up toward his chest and when he rotated the hip inward, and pain when he had testing of the resisted hip flexion. A couple of x-rays here with an arrow for you, and there is a piece of bone, a fragment right there on the right image that you can see that's not in the correct spot, and it's known as a avulsion fracture. So I think of these in the growing athlete as an Oreo cookie with bone, and cartilage of the growth plate in between it. And it's typically after the appearance of the secondary ossification centers, and that's usually in adolescence. We see this a lot in runners and sprinters, especially when they build up their activities after prolonged rest. We have altered growth rates, so the rapidly growing time periods, those growth plates are more vulnerable to being pulled off, and can also be related to decreased flexibility and increased stress. Usually kids will complain of soreness in a particular area near the bone, and then symptoms can change. Feel a pop, acutely worsening pain where it was just a dull ache. And I have a list of a few different places around the hip, but there's multiple areas that can have these avulsion fractures. Really, if you have one, the treatment is rest, only putting part of the weight on that side, exercises, and then a return in about 6 to 8 weeks. It rarely requires a surgery. Most important thing is, how do we prevent this? Main thing is appropriately warming up and stretching. Progression of both intensity and the duration of training so the body can gradually adapt to those increased stresses on those growth plates. And we want to identify players that complain of a hip area soreness or pain that they can palpate. If they can say, my bone is sore, and they press on it, then that's a concerning area of irritation to that growth plate, or even an early, what we call apophysitis. And there is a role for vitamin D in all this. It's not well described, but I think if you have vitamin D deficiency, I think that does put you at increased risk. Let's move on to the second case. Okay, case number 2, a 16-year-old female cross-country runner, worsening right hip pain, specifically in the front, in the groin area, about 3 weeks after returning from running from an extended break and increasing mileage, making up for the lost time, so to speak. She had a pronounced limp after about a mile of jogging that persisted despite rest. So we stopped running and she kept limping. I have an x-ray here, I have an MRI here of the right hip that shows a bunch of white area along the bone and basically a crack in the bone known as a stress fracture. So this is something that we don't uncommonly see, particularly as we try to, quote, make up for lost time, really increasing intensity of training, mileage, particularly in the female athlete. Some of them may actually need surgery, and some of them can cause significant problems if they're left untreated. One important part as we get back into training is evaluating for underlying nutritional issues and contributing factors. So, in summary, you want to beware of the limping, thin female athlete that complains of hip pain. Prevention would be a gradual increase in impact activity and screening questions to evaluate for females at risk: irregular menstrual cycles, weight loss, poor nutrition or eating habits. And nutritional optimization as a part of training is a main preventative measure. All right, case number 3. 14-year-old obese 8th grader notices a worsening limp when increasing activities and complains of right knee pain. No injury. Now, granted, I'm talking about hip problems in the young athlete, but this is one that can be a little tricky. So no injury. He has somewhat of a waddling gait when he walks and starts to rotate his leg outward more recently. Family notices, coach notices. They haven't really put it together because he complains of knee pain, but they notice that he's not walking the same. This is an x-ray of a major problem. This is called a slipped capital femoral epiphysis, or a SCFE. You may have heard of it. You may have had family members or known of a child that's had this problem. And this can cause devastating lifelong problems with the hip and even needing a hip replacement as a young kid. This is bad. So I always talk about a SCFE as the knee pain masquerader, meaning this is one of the problems that involves the hip, but patients complain of knee pain. And really any adolescent, so ages 8 to 14-year-olds with vague knee pain and obesity, this has to be considered. It really needs an immediate referral. This is something that cannot go on indefinitely, as it may lead to permanent damage. So an assumption would be, and you're noticing a common theme with all the hip injuries, is limping. So any obese adolescent with a limp, particularly complaining of knee pain, is a SCFE, or slipped capital femoral epiphysis, until you prove it otherwise. The key findings really are knee or distal, so lower thigh pain, particularly the kind they can't put a finger on. And when you watch them walk, they'll start to turn their foot outward, and they'll even have a lurching or a antalgic gait. Prevention really with this is early a diagnosis. There are kids who've been sent to months of physical therapy. There have been kids who've had surgery on their knee when the problem has really been the hip. And so we want to identify it early. So if they're limping and they're obese, it needs to be at the top of the list. If they have vague knee or thigh pain with no visible knee injury or tender region, it should be something to be considered. All right, case number 4. 15-year-old male returning to off-season weightlifting. Hips feel tight with deep squats, begin to experience groin pain, and occasionally will limp. Worse with the deep squatting, pain now with cutting and pivoting as he's getting back to his exercises and his activities. And he has pain with flexing the hip deeply or rotating it inward. The image that I'm showing you is that of a femur, and I'm drawing lines on it. The first line is the normal relationship of the femur and the sphericity, or the circularness of the femur. The green line is where that circle should continue to, and the red line is where it is on this patient. And I've created a shaded region that shows an abnormal bone growth. Very common in athletes, but this can lead to something called femoroacetabular impingement, or hip impingement. It's not an injury per se, in that the activities of the athletics don't lead to this abnormal bone growth for the most part. However, the position of the bone and its shape, if it's being forced into an area where it's not supposed to be, mainly deep squats or forced inward rotation, can lead to damage inside the hip and the pain. So these tight hips result from the prominent bone growth, which can damage something called the labrum, which is a structure inside the hip, and can even lead to arthritis if left untreated. Really, the keys for this are identifying our pain in the hip that's worse with deep squats, the butt to the floor squats per se, or rotating the hip inward, which sometimes you'll notice can be done to increase flexibility. So even well-intentioned trainers can exacerbate these symptoms because of the forcefulness of those motions inward in the hip. Preventing it is really allowing the athletes to accommodate their bone structure. So some athletes have tight hips because the bones are shaped that way, and really there's nothing to do about it aside from allowing them to have tighter hips. So I say let tight hips stay tight in flexion and inward rotation. If you're going to stretch them, you want to stretch them more in outward rotation. So with the feet toward the center and the knees rotated out, and bringing flexion from there. Really focus on hamstring stretching, extension stretching or bringing the leg behind them, abduction, the splits, or flexion, like I said, with the hips outwardly rotated, and really avoiding squats that are deeper than 90 degrees, particularly in these patients that will complain of tight hips. This may be all that's needed to keep this from being symptomatic. So take-home messages. Hip pain that causes a limp is always concerning. Don't blow this off. And serious hip issues in obese adolescents can appear to be knee pain. Very confusing, but obese and knee pain or limp need to think that it could be the hip. And it's rare to need to increase flexibility in the tight hip, and the tightness may be related to bone structure. When in doubt, have it evaluated with your athletic trainers and with your trained medical staff. More information related to kids' injuries can be located at this website, www.stopsportsinjuries.org. Remember, have a safe return, be mindful of the hip injuries, and please contact us if you have any questions. We're here to help.